here, the first thing we talked about, were the amino acid disorders that we talked about. The amino acidopathy, I would know the definition for that. I would also know, out of the amino acidopathies we talked about, which one did I tell you is generally the most common? Of all those amino acidopathies. PKU. Everybody remember that one? Phenylketonuria?
Yeah.
I showed you a little card where they touch the baby's heel and fill up the little circles with blood. Now, there's a lot of material for this next test, but I will just go on a limb and tell you that, I mean, I may ask a couple of questions about some of the other ones, but if you run out of time for studying, you want to spend more time studying on PKU than the other ones. I did tell you though that you need to look at all of them, pick out the important things, like which one of them can turn the urine black upon standing. Anybody remember that one?
Melon.
Alkaptonuria. Remember, it's got the homogentisic acid that'll cause the urine to turn black. I told you to kind of group them into which ones can cause mentally challenged babies.
Oh, yeah.
PKU is the big one that will, yeah, but there's some other ones that can cause mentally challenged problems as well. What's the urine smell like? Remember I told you the smell of certain things?
Musty or mousy. I know one of them's like dirty feet. One of them's musty and mousy.
Yep. Go through there and pick out the abnormal smells that are caused. I also told you to understand the enzyme deficiencies for each disorder. Does anybody remember what the enzyme deficiency is in PKU? Phenylalanine?
Yeah.
There's more to it. What's the enzyme deficiency? Phenylalanine hydroxylase. That's the enzyme deficiency for PKU. Okay, so we went through and we talked about all of those amino acid disorders, and then we actually started getting to the proteins themselves, and I started bringing up different protein names, and I said, know the main function of things. Like, for example, if I bring up the protein transferrin, what's the function of transferrin? Okay, but there's lots of them. Okay, so that's not the only one. Remember, there's ceruloplasmin, there's fibrinogen, there's haptoglobin, all of these immunoglobulins. You know, one thing I do, and everybody studies different, but if I was studying for this exam, I would draw those mountain slopes out. Okay, and I would say, look, okay, so you got albumin, and then you got the alpha 1 proteins, the alpha 2, the beta, and the gamma globulins. And if you could list like the major players under each mountain slope, albumin's easy, right? It's just albumin. But like that last broad slope at the end, the IgG, the immunoglobulins, remember GMAID, remember IgG, IgM, A, D, and E, and even each one of those have specific characteristics about them. Like somebody tell me some characteristics about IgG antibodies.
It's smaller than them all. It needs Coombs to be detected.
Yeah, I'm good with that, but I won't ask you blood bank questions. I mean, but you're right. IgG is known for crossing the placenta. It's very small. It's an incomplete antibody.
It's also the most numerous.
Once it's activated, it can be. I'm more interested in it's part of the secondary response. In other words, if you get an infection or something, what's the primary response?
IgM.
IgM. That's the first one. For any of you that are getting your hepatitis immunizations right now, if it helps you to remember it, if you have an IgM antibody, that means you have had a recent infection or you currently have it. Okay? And IgG is known as secondary immunity. That's what they're hoping you have. Because if you have the IgG antibody to hepatitis, that means that you had it and you're over it and you have immunity to it now, long-term immunity. IgM means you have a recent infection. You don't want to be around somebody that has an IgM antibody, okay, for hepatitis. Because that means they recently had it. Where are most of these proteins produced at in the body? Remember I told you, if you ever have to guess an organ, what do you say?
Liver.
Liver, right? The liver is responsible for producing a lot of proteins, but there's one protein that's not produced by the liver.
Immunoglobulins.
Who said that?
Me.
Immunoglobulins, yes. And what makes the immunoglobulins?
The white blood cells, the
White
B
blood
cells.
cells slash plasma
okay,
cells.
okay.
Plasma cells and white blood cells, those are the ones that produce your immunoglobulins, okay? That's the only exception to the rule. The liver produces everything except the immunoglobulins, and the immunoglobulins are produced. Now I'm talking about immunity within the body, okay? The only other one is going to be the plasma cells for the immunoglobulins. Okay, so let's talk about that mountain slope again. You got albumin. You got albumin. Remember this second one right there? Anybody remember that one's called what?
Alpha-1.
Alpha-1. And which protein makes up 90% of the alpha-1 band? Somebody said it.
Antitrypsin.
Alpha-1 antitrypsin. This is the one I told you that can lead to emphysema if you don't have it, if you're deficient in it. What they worry about on this mountain slope generally is not having it, okay? If you're lacking alpha-1 antitrypsin, okay, you're gonna be a person that's highly susceptible to getting emphysema.
So, do we have pre-albumin right before albumin, is that right?
There is one, yep, pre-albumin. And there's another one in the alpha-1 antitrypsin makes up 90% of it, but another player in that is alpha-1 fetoprotein. Remember that one? It says it, alpha-1 fetoprotein. That'll be there as well. All right, let's go through a couple of others. Just a couple of proteins that I think are important. What about celluloplasmin? Anybody know what that's got to do with it? Celluloplasmin. Okay, yeah, I mean, that's fine, but what is like if I just told you anything about celluloplasmin, it's the most important thing as far as the function of it. It carries copper. Okay, good. So we got transferrin carries iron, celluloplasmin carries copper. What else is in there? What does haptoglobin do?
Primary function, bonds free hemoglobin.
Binds free hemoglobin.
Okay.
Okay, so you see how I would study that? I would learn the major function of each one. What about C-reactive protein?
Inflammation.
Good, inflammation. It's one of the acute phase reactants, inflammation. I'd like to write those down on a sheet of paper. Like write down each one, like the major function of each one, and be able to cite those. We talked about ways to measure proteins. We did a lab, and I don't know if you guys remember, but we did a lab measuring total protein. You guys remember us doing that lab? It was like our very first spectrophotometry lab that we did in there for total protein. I remember that? And I told you guys there's a reaction that you always need to remember for total protein. Anybody remember what the name of it is?
Biuret?
Biuret reaction.
Oh. So that's the most common.
Okay, so that covers the majority of that chapter. What's the lab we did that makes those mountain slopes if you put it through a densitometer? Serum protein electrophoresis. You guys did that, right? Remember, you got the little gel card at the end, and you can put that into a big, huge machine, and that's what would draw out your mountain slopes. Remember the dark band you got that traveled the furthest? That was albumin. So that's going to be your real large mountain slope. What did I tell you guys to watch out for in CSF fluid for which type of? We talked about one thing on electrophoresis. If we were electrophoresing spinal fluid, I told you it's found in people that have multiple sclerosis. That oligoclonal banding. So those little bitty bands in the gamma region that can indicate
right there.
multiple sclerosis.
239.
It talks about that on page 239. Okay, chapter 12, we started talking about non-protein nitrogen compounds. So we were talking about things like urea, uric acid, creatinine, and ammonia. So, what about ammonia? You go draw an ammonia level, somebody tell me something about it.
Draw an ice.
You know, ice and hopefully it's supposed to.
Yeah, and you have to do it stat, cause, more ammonia can form.
Have to do it what now?
You have to do the tests on it stat.
Yes,
Yeah.
good.
You know,
Good,
spin it.
good.
and some more ice.
Don't want your patient to be smoking before that test, because smoke can contain ammonia, but yeah, you do wanna do those right away. Which one of those goes with gout?
That's me.
Uric
Acid.
Creatinine. I told you guys something about whenever you're doing a creatinine test, I told you there's a certain, they love to ask this. They look like Darren said, total protein was the biuret reaction. What is the reaction, or what's that big name they're looking for if you're doing a creatinine test? Starts with a J.
Oh, yeah.
The Jaffe reaction. And there's an ingredient that they sometimes ask for, and I realize you guys did not do this lab, but I still gotta have you pass that test, okay? And the reagent that they use is called picric acid.
Can you spell that?
P-I-C.
Yeah.
P-I-C-R-I-C.
See.
Okay, thanks.
Picric.
You had some key terms when we talked about, urea levels. Like I says, an increased urea level in the blood, there was a definition for that. Azotemia. And I think that there's another term that you had that said an increased urea level in the blood that goes along with kidney failure.
Or uremia?
Uremic syndrome,
Yeah.
maybe?
Yeah. It's one or the other. Both of them go together.
So remember, I mean, study your definitions, guys. I mean, I'm not gonna go over every one of them, but if I give you guys a list of definitions, study them. Okay? I'm not wanting you to memorize them, but I'm wanting you to at least be able to pick out important parts of it. We talked about a BUN creatinine ratio. You might wanna look over to that. Does anybody remember what the normal range for a BUN creatinine ratio is?
10 to 1 to 20 to 1.
We talked about different types of increased urea levels. We talked about, for example, pre-renal, renal, and post-renal problems that can cause your urea. What was one of the pre-renal conditions that can cause you to have an elevated urea?
Congestive heart failure.
Good, okay. What about a post-renal? There's only so much stuff post-renal, right? You got the kidneys, and then from there on to the, actually voiding urine, what could cause that post-renal condition? What could cause something to back up?
Oh, cystine formation, kidney stones.
Which would be you get them.
Kidney stone, yeah,
A renal calculi,
yeah.
something like that. In other words, after the kidney. You know, make sense of this stuff. Post-kidney means after the kidney. What could cause something to cause your urea level to be increased in your blood? Something's obstructing your urinary flow, right? People that have renal calculi have a hard time voiding urine. Especially, I don't know about females, but guys, I know that's supposed to be the worst pain you can feel, right? Or one of the worst pains. Then we got to enzymes. Spent a lot of time on enzymes. That should be in, I think, chapter 13. You had some definitions for enzymes. Remember I drew up on the board and showed you the lock and key concept? Right, so make sure that you review that information. Look over enzyme substrate complexes, what that means. And then I also told you that I wanted you to be able to know all the abbreviations for the enzymes in the names form. Like Darren obviously knew the one for LDH today. I think I gave two, LD or LDH, would be lactate
LD is what you gave.
dehydrogenase. I probably should have put LDH too, because a lot of techs are gonna call that LDH, they're not gonna call it LD. But be able to recognize that, okay? Again, there were other enzymes, and I know, I think you guys took pictures of all that stuff I wrote on the board. know that, understand, okay, he talked about enzymes, which ones go with the heart?
CK.
And then there's, what does CK have that you can actually be more specific for the heart? Remember that they have isoenzymes,
Mhm.
okay? Remember I told you the CK, and then there's a CKMB, alright, that's an isoenzyme of the total CK, alright? What about, let's say, tell me some enzymes that would indicate pancreas problems.
Lipase and
Amylase and
amylase.
lipase?
Yeah.
ALT and ALT too. Okay.
And now all you need to know is you need to know the abbreviations for that stuff, okay? What about some liver enzymes?
Yeah,
AST, ALT, that's the two big ones, but there are other ones. There was an
AL
enzyme I told you guys that they monitor alcoholism.
Is that ALP?
That's GGT.
Oh, GGT.
Gamma glutamyl transferase. Alright, that's the one that a lot of times, your heavy drinkers will have an elevated GGT. So I would break it down into, like I said, body organs. What about your prostate?
gonna be your PSA.
PSA, but that's not an enzyme. PSA is a prostatic specific antigen. But there was an enzyme, I did tell you they don't do this test a lot anymore, but out of all the enzymes we covered, there was one that is specific for the prostate.
ACP.
Acid phosphatase, and that's abbreviated ACP, acid phosphatase. There was one enzyme, I showed you guys a graph. That graph isn't, well, I guess if I had you turn to the page, you'll know the answer. But there was an enzyme that I told you was one of the longest lasting enzymes following a heart attack on page 270 that you need to be aware of. Like if somebody waited, let's say they waited to come to the emergency room 7 days after they had chest pain, okay? There's only one enzyme that'll stay elevated for that long.
LD.
LD, lactate dehydrogenase. And again, that graph is on page 270. They do not normally do that test for a heart attack. I'm just telling you an extreme situation. LD actually falls under a liver enzyme, but it can stay elevated also in the heart. Remember, a lot of those enzymes are found in multiple tissue sources all over the body. So there's not just a perfect answer where I can tell you every single time LD will be elevated in a heart attack. Because it's also found in liver, it's found in heart, skeletal muscles, and all of that. But there are some that are more prone to be toward the damage of a certain organ, like the prostate, acid phosphatase, okay? Pancreas, amylase and lipase. The heart, you got your CK, your CKMB. Now there were also a couple other isoenzymes of the CK. Remember there's CKMM, which is found in muscles, CKBB, which is found in the brain, and CKMB,
Which is a
which is
combination.
what I call kind of a hybrid, but that hybrid is found particularly in the heart. And that is a major, that's a major test that they do in the ER with patients that come in chest pains. They'll do a total CK or a CK, but then they want to know that one isoenzyme, the CKMB. Now there may be some of you that work in the hospital and say, why aren't you mentioning troponin? It's because we're not on that chapter yet. Okay, so hemolyzed specimens. Tell me two analytes majorly affected by hemolysis.
Potassium and
And potassium is what? What category is potassium?
Electrolyte.
It's an electrolyte, okay? And there is an enzyme that is majorly affected by hemolysis. LDH, good. Your LDH is majorly affected by hemolysis. Magnesium too, but if you have to study one, like the two biggies affected by hemolysis, I want you to remember I'll never forget, there's a tech that works with students, and she told me one time, she said, the first question I ask a student when they walk in the hospital is, which analyte is most affected by hemolysis? They're just wanting to see what they know before they get the clinicals. The answer to that, potassium. Okay, potassium. Because LDH is not ordered a lot, so if you just have to pick one, potassium is the answer about hemolysis, if it's just ordered too frequently. Anybody remember what the normal range for a CKMB is? Okay, again, I know you should be saying, hold it, you told us not to know normal ranges. Well, the CKMB, I just want you to remember something that they look at, whatever your CK is, let's say your CK is 100, that's your creatine kinase level. If it's 100, what you want to watch out for is your CKMB never needs to be greater than 6% of the CK level. So there's not really a normal range per se, but if your CK is 100, you don't want that MB being greater than 6, okay? That means the isoenzyme, CKM, MB type isoenzyme never needs to be greater than 6% of the total CK level. So if the total CK level was 200, then it doesn't need to be more than 12, right? There were also isoenzymes of LD levels, lactate dehydrogenase. There's like 5 or 6 of them, okay? And remember I told you, and I'm breaking my own rule when I say this because I'm teaching to the test when I tell you this. There's one thing that it seems like if they ever ask you about the isoenzymes of lactate dehydrogenase, they're asking you about what they call the LD flip. If LD1 is ever greater than LD2, that can indicate a myocardial infarction or a heart attack. Now, I told you guys to highlight that. If you look in your book, you should have highlighted a section in there that talks about the LD flipped pattern, okay? And you need to make sure that you read over that. If you guys hadn't figured it out yet, you need to know a lot about things that go up with heart attacks, okay? An LD flip pattern, an MB level, you know, because heart attacks are a frequent thing that you know, you're gonna be testing a lot of blood and stuff off people that think they're having a heart attack. G6PD, somebody tell me about that.
That's your red, that's your
I'm not asking you about the father.
red blood
Y'all mark
cells.
that off.
It involves your red blood cells. That. That's the one thing.
On G6PD, you're looking for a deficiency more than you are an increase. People that are deficient in glucose 6-phosphate dehydrogenase, their red blood cell membranes tend to be fragile when they take certain medications. I think I told you guys in class, people that take anti-malarial drugs, for example, it's just it's a reaction that occurs in some people. That's how they find out some people have a G6PD deficiency. The patients don't even know it, but let's just say they live in an area that is endemic for malaria. Well, they give them an anti-malarial drug, and then all of a sudden they have a hemolytic anemia episode. The red blood cells start lysing because the red blood cell membranes are a little bit fragile because they have a deficiency of G6PD. All right, chapter 14, we talked about carbohydrates. I think that this is pretty smooth information. I think you guys will do good on this section. Just be able to differentiate type 1 diabetes from type 2. We talked all about that. Which ones are insulin dependent versus non-insulin dependent. Type 1 usually is found in adolescence. That's when they figure it out, okay? Know your key terms. There were some key terms for this chapter. gluconeogenesis, glycolysis, all of that. That's on you guys to study those key terms and know what those words mean, okay? What's one thing a type 1 diabetic, what's one thing they're really having to check themselves for all the time?
Insulin. And blood sugar.
Blood sugar, yeah, but what means they're doing bad?
Oh, they're
A1C.
That's a long-term test, good. Ketones. You don't want ketones to come up positive. Type 1 diabetics, if their ketones are positive, they're in danger of going into ketoacidosis. Wendy, what's the name of the test for long-term diabetic control?
That's the A1C, it's a hemoglobin A1C.
That is a glycosylated hemoglobin. That is the number one test that measures your glycosylated. It's the most common test performed for a glycosylated hemoglobin. What are two things I told you that go into that test? The glycosylated hemoglobin. Long-term glucose value, right? Over long-term, but there's one other thing.
And so lifespan of the red blood cell.
Yes, okay. And a physician would need to know that, because just what if you were doing a hemoglobin A1C on a patient that had some sort of anemia, iron deficient anemia, to where their red cells weren't living 120 days. That could affect that test, okay? So the long-term glucose level and the lifespan of the red blood cell are two things that go into that test. When plaque develops in the veins of the arms and the legs, what's that called? But what type though? Arteriosclerosis? That'd be peripheral vascular disease. Remember, there were three types of arteriosclerosis. I told you guys to know peripheral vascular disease, you know, people that are in danger of stroke, coronary artery disease, that's people in danger of a heart attack, all right? So stroke would be cerebrovascular disease. So be able to pick those out. Okay, lipids. What's the good cholesterol called?
HDL.
What's the bad cholesterol called?
LDL.
Okay. Which ketone body is actually detected in the test for ketones? Remember there's three ketone bodies, and I said the test actually detects one of them.
And that one's I just remember the number 20 that goes with it.
First of all, let's name the three ketone bodies. I'm not looking at it. I hope I know it. You got acetic acid, acetoacetic acid, and beta hydroxybutyric acid.
It should be the acetoacetic acid.
Acetoacetic acid. Okay.
Because if that one's elevated, the other.
You know what?
two
I just
are.
told you wrong. It's acetone. Acetone, acetoacetic acid, and beta hydroxybutyric acid. That's the three ketone bodies.
Somewhere.
Okay, we got today's. You're gonna need to know how to calculate an LDL. I've already told you that's on there. And you're probably gonna have an essay question where you've got all these results over here, and you're gonna have to calculate an LDL level. So you're gonna have to pick out all those values in order to calculate that, okay? You may also have to calculate an anion gap from those same values. So again, you have to know which analytes to pick out, and you have to know the formulas for that. Okay, chapter 16, that's what we covered today, the electrolytes. Just pay attention to like the most abundant intracellular cation, for example. What would that be? Most abundant cation that's found in intracellular fluid. Potassium. Cation inside cells. Okay. But it's all those little sayings like the most abundant anion, the most abundant cation, whether it be intracellular or extracellular, be able to distinguish those, okay? Also know all of those abbreviations, know the major functions that I told you about. Look, if I only spent 20 seconds today going over phosphorus levels, don't spend 2 hours studying about phosphorus levels.
Phosphorus is gonna be kidney failure too, right? Cause they test Chris's a lot, phosphorus levels.
Yeah, but that ain't really what we covered today.
Well, yeah, I was just
But,
wondering if the test works relevant at.
Yeah, but like, if I spent a long time talking about, for example, the drawing technique for lactic acid, then pay attention to that, okay? Study that. I've had this discussion with various students in the class, but there is so much material to cover within these chapters that I've got to cover what I think is the most important. So don't spend, just try to think about what we did in lecture and what I spent the most time on and emphasize the most. I know that that's not a perfect science to give in a test, but if I asked you everything that's in all these chapters, I would have to ask you 400 questions on this test, okay? Okay, as far as the exam, there is 53 multiple choice questions. There is a question concerning an LDL calculation and an anion gap, so that's throwing it out there. I did pick a case study that we went over in class. I'll leave it at that. Okay, there is a case study very similar to one we went over in class. And then I do have a lot of abbreviations. I think I got 1, 2, 3, 4, 5, 6, 7, 8. I've got like 8 abbreviations that aren't all enzymes. Not all of them are, but a lot of them are, to where I have the abbreviation, so I'll tell you how to study for it. I have the abbreviation and you write out the name, okay? Those are worth 1 point apiece. And then I'm doing something a little different because I'm just making sure you guys aren't studying like just code words to get all these definitions right. I've got 9 definitions on the test that I want you to write out the definition for. And I'll even give you one of them just to be nice. One of your definitions will be zymogen. What? Zymogen. I'm not telling you what it means, you gotta look it up. I'm telling you it's on the test, that's one of your definitions will be the word zymogen. But that's what I mean by definitions, okay? You'll have to write out the definitions, those are worth 2 points apiece. So that's 18 points just in definitions. Wow. But this test is worth a lot more than 100 points as far as the overall value of the test. But once I grade it, it's based on 100 points. All right. Anyway, a lot of information on this one. I hope you guys change it, but usually the scores go down a little bit from test 1 to test 2. You guys proved me wrong this year. All right, you guys will, we need to take about a 10-minute break anyway. You guys can do it however you want to. I do need to see each one of you in my office, starting at like 10 minutes after 10. I'll only see you briefly and then come back to the classroom and send the next person, okay?